Hello and welcome back to Valley Life. I am Rich Krebs and very excited. I wanted to bring you a treat from the South Valley. However, I think a lot of you folks up to the north and even as far south as Bakersfield are going to get excited about this because I want to introduce you to Dr. Russell Horine. Doc, how are you?
Real good, Rich.
Good. I'm excited to speak to you. I love your practice and what you're doing to manage people's pain. I want to get into the peripheral neuropathy a little bit and a lot of what you have going to help manage that. But I think I want to get an overview of the holistic approach you're taking to help people manage their pain and improve their lives greatly if they just listen to you and kind of attack it aggressively. Give me an overview of what people are coming to see you for.
Well, once we've established that a patient does indeed have peripheral neuropathy and that they are a good candidate for my program, then we can actually initiate the peripheral neuropathy recovery program, which is actually a three-part approach because we have to hit this condition pretty aggressively. It's not a condition that you can kind of nibble around the edges on.
Yeah, just one hit and you're out. See ya.
No, you really have to go after this because this is a tough condition.
Sure.
Most people that have this condition have been told that there's nothing that can be done other than taking pain meds or sleeping medication, help them sleep at night. And the problem with that is that those medications do nothing to heal the nerves.
Mask the pain.
Exactly. All they do is make the person feel better or sleep better while the condition continues to deteriorate. Okay. So the approach we take is a three-part. We first work at rehabilitating the damaged nerves as much as possible. Okay. Part two is we work at improving the brain to nerve communication. This is called brain-based therapy. Okay. And then the third part is we work metabolically to take care of any of the triggers or pathways that could be causing or contributing to this condition. And that could be everything from, the most common, of course, is insulin resistance or diabetes. It could be a thyroid dysfunction. It could be malabsorption. It could be vitamin deficiencies. There's several things that can cause this. And we really need to first play a detective and try to figure out exactly what the triggering problems are that's causing this, and so we can get to the underlying cause of this condition as opposed to just masking it.
Sure. And I think that if anyone's watched this show for any period of time, you know how important I like to put emphasis on nutrition. But once you have started to manage someone's condition, if they're not eating properly, then they can fall right back into the same symptoms. So the approach that you're taking then will help them not just have a quick fix, but start feeling better for the rest of their life.
Long-term approach, yes. So we do a lot of intervention with diet, and we make it realistic because we all want to enjoy life and have good life quality. But if we're eating things that are actually contributing to a disease, then we need to know about it, and we need to deal with it. Okay. So we usually put them on a 30-day low inflammation diet, and that usually does a really good job of kind of getting the ball rolling as far as the healing process, as well as using supplementation, very targeted supplementation for this condition. And everybody's different. A cookie cutter approach does not work with this condition. Right. We really need to attack this problem very specifically for the patient and the condition they have. The key is I don't treat the diagnosis, I treat the patient.
Perfect. I think that taking that approach, people are going to feel more comfortable knowing that it's not cookie cutter, it's getting to the bottom. You like to play sleuth, and once you found some of the problems, then talk to me a little bit about how you manage some of it with the different approaches you take, whether it's KT tape or cold laser, that kind of thing.
Well, there's many therapies that are actually very effective for managing this condition, and so we look at layering the therapies depending on what the patient needs, and this could be anything from a cold laser therapy to pull out local inflammation and accelerate healing, kinesiotaping to increase or decrease tone where necessary. A lot of patients with this condition have leg cramps at night, and kinesiotaping is a wonderful way, short term, of dealing with that until we can long term deal with the actual causes of that. We use inspiratory muscle training, and which is a great way of increasing oxygen delivery to the damaged nerves. And this is something that they do on their own, and so long term they can actually pull in more oxygen, and of course we all know more oxygen the better.
Sure. And before we run out of time, because I could sit here and talk to you all day about this, the main thing first is find out if you got it. Come on in, get an assessment, maybe call for your information pack so they can start doing their own research on it, feeling more comfortable about what you do, and then getting the assessment to find out, do you have peripheral neuropathy?
Correct.
Give the man a call. I'm telling you what, he's here to help. And the whole thing is making you feel better and then doing it properly so it's not just a short-term fix, but getting you back on your feet to where you need to be and then keeping you there. Don't go anywhere. There's more Valley Life coming up right after this.